Hello and welcome. Today we're looking at small intestine 3. So that's going to be our point of the week. So I'm hoping you're going to gather some very good information today as to how you can utilise that within your practice, particularly for treating cervical problems and also for treating low back pain. It's an excellent distal point that has a very strong effect. Always remember, warn your patient because it is quite a sensitive point when particularly needling. So I have known it to make some patients' eyes water to a certain extent. So I always brief my patient that it may well be pretty tender on needling itself. Needling technique is approximately 0.5 to 0.7 suns or centimetres in penetration. So key thing to remember, its location just above the transverse crease when the small finger is flexed, just proximal to the metacarpal phalangeal joint. So again, quite a good distal point to actually use and quite a good distal point to actually remember to use. Now, treatment-wise, condition it will actually address is either acute or chronic cervical, thoracic or lumbar disorders. It is a shoestring point of the small intestine, so therefore it will address pain along the course of the small intestine meridian. Same again, it will also address trigger points along the course of the small intestine meridian. Those trigger points are mainly located in the teres minor, teres major, supraspinatus, infraspinatus and also the levator scapula. Studies have also demonstrated its effects, particularly in treating conditions such as rotator cuff tendinitis. So again, a good, excellent point for treating shoulder disorders. With regards to treating the spine, particularly in chronic disorders, I utilise this point quite frequently. And what I basically find is if I'm in a situation where I don't particularly want to mobilise the spine, I can utilise this point. It is the opening or the master point of the Dumay channel. So therefore, before putting points into the Dumay, then you need to needle this point first. Particularly if you're looking at a chronic condition, I would needle this point first. Then I'd also use what you call the extraordinary vessel, where I'd utilise my urinary bladder 62 on the opposite side. So say for example, my disorder that I'm treating is on my left side, then I would needle my small intestine 3 on the left side. Then what I would basically do then is to needle my urinary bladder 62 on the opposite side. Then if it's lumbar disorders that I'm actually treating, chronic, I could utilise then my Dumay 3 or my Dumay 4. If it's a surgical disorder that I'm actually treating, then I can utilise Dumay 14, Dumay 15 or Dumay 16. So I find those point combination, but ensuring that I put my small intestine 3 first is quite good. So again, in acute cases, it is quite good for treating low back disorders because primarily if you're treating low back and it's acute, you do not want to be needling directly into the location. So small intestine 3, as we say, it activates the Dumay channel, ideal for sprains and strains of the low back, also ideal for sprains and strains of the cervical spine, particularly in whiplash conditions and things like that. So again, at least you're not having to put a needle directly into the area, which may well exacerbate or inflame or bring more blood to the area and causing more nociceptive pain. So as general, overall point that I highly recommend those of you who's regularly treating low back pain or low back disorders. So thank you for listening. If you wanted more information on the small intestine 3, then you can go to our website. That would be www.stevebailleyacupuncture.com. You'll find my blog in there that we'll be putting up there, addressing more information on how to use small intestine 3.